here to expand on the possibility of a Judge Barrett confirmation and what it could mean for health care is health insurance legal expert Jan Dubauskas. So Jan, I'm really glad to have you on the program right now. Right now, a lot of Democrats very fearful that the Affordable Care Act could be done away with if Judge Barrett were to make it as a Supreme Court justice. Do you think those are valid concerns?
Yes, I do, Alex. Thank you for having me on tonight. What's really going on here is when the Tax Cut and Jobs Act was passed, President Trump's administration took the individual mandate down to $0. And the question before the Supreme Court, which is going to be argued on November 10, is did that zeroing out of the individual mandate invalidate all or part of the ACA? Now, when we had Justice Ginsburg in the seat, we were pretty confident it was going to be 5-4, the ACA remains valid moving forward, just no individual mandate. Now, if you have another justice on the other side, 5-4 the other way, she could either, participate in a ruling to invalidate part of the ACA or all of the ACA. And that's one of the things that's really got people very concerned about the ACA moving forward.
And of course, a big part of that conversation even goes back a little bit further is when Justice Roberts was the swing vote on that decision, where it was a matter of whether or not that mandate was a tax or if it was just a provision within that bill that required people to get on that program. So now we see a possible situation where Chief Justice John Roberts is no longer the swing vote, of course, with the confirmation of Judge Amy Coney Barrett. But that would then mean Brett Kavanaugh would be the likely kind of middle of the bench type of figure, meaning that the Affordable Care Act now faces a much harder scrutiny, I'm assuming, by these conservative justices. So I want to ask you, what would a repeal or a decision that shoots down the Affordable Care Act mean for the average American?
For the average American, what they're going to see is a transition period. So the reality is that taking away the ACA is not something that you can do with the snap of your fingers. People have insurance coverage, number one. And number two, the oral arguments are November 10. We're probably not going to hear a decision out of the Supreme Court until sometime in the spring of 2021. So anybody who's got an ACA plan today, looking to sign up in open enrollment, your plan is going to be okay for a while. There's probably a 2-year transition period, something like that. In the meantime, everyone's plan will continue as usual until we have a time where the states and the insurance companies are working together and they've developed the whatever the new plan will be. And then that will roll out. And frankly, from an insider perspective, those things take time. The states have to develop the rules. They work with the insurance company, say, hey, these are the rules. The insurance company submits them to the Department of Insurance. They go back and forth, and then it actually gets implemented in the computer system. So all of this is going to take some time. Consumers should be reassured that their plans are not going to go away tomorrow, and they should continue with the plans that they have. And if they're planning on buying an ACA plan for open enrollment, you go ahead and do that. It'll be okay.
Yeah, and with the Tuesday debate coming up, too, this looks like it is a little bit more of a campaign issue for the time being. And that's not to say that there aren't real implications that will come as a result, but it looks like the Biden campaign in particular wants to make the Affordable Care Act a central piece of their argument against the Trump administration. And really Judge Amy Coney Barrett as well, kind of saying that if she were to be on that bench, millions of people could lose their private insurance. That's really what they're trying to say to a lot of these people. But another conversation that comes up as well is Roe v. Wade. And I know that that does have health insurance implications. It does have a lot of things. It's wide-ranging apart from just the decision itself. So if that decision were to be in jeopardy, would there be healthcare implications?
Well, your health insurance today, it only covers something if it's a medical emergency, right? The elective procedures are not covered. So if Roe v. Wade were overturned, it would go back to the states, and then the states would make those decisions. And that would be communicated clearly to consumers at the time. What we're seeing from President Trump really is a healthcare reform, and what we're seeing from the candidate Biden is health insurance reform. And that's what the two are really butting heads about. And I'm very excited to watch it on the debates tomorrow night.
I mean, it is going to be exciting for a number of reasons. And although healthcare is not necessarily one of the subjects that they said they are going to be discussing in depth, I'm sure it's going to come up still, perhaps maybe during the Supreme Court subject matter. I believe that's supposed to take part in one of the first 3 subjects. Of course, it's going to be 15-minute intervals, so I'm sure it'll come up at some point. But when you look at these two candidates, I mean, sometimes we get caught up in the news cycle and it seems that whoever wins, it's going to be the end of the world for the other side or vice versa. But when it comes to the Affordable Care Act, for example, and what the Trump campaign has put forward at this moment, are they that different? Are they that game-changing different for the average American?
Absolutely. They actually are very different. President Trump is looking to reform health care, which is actually bringing down the prices of health care. It's increasing the innovation. What he wants to do is provide more choices for consumers. So, women like me who are 45 years old and not going to have a baby are not paying for maternity coverage. So, more choices, lower costs, and better care. That's really what President Trump is going for with his health care reform plan. And then, if the ACA is invalidated, then we'll see a more comprehensive plan come out of his administration. And I think it's going to be along those lines again of offering choices to folks, catastrophic level coverage, or do you want more? And then things are going to help them fit their wallet. On the other hand, candidate Biden, he's really proposing a Medicare for All light type plan. That's what I call it anyway. It's the public option, but if you look at the details and go to the website, which I did, the plan actually is a Medicare-based plan, this public option. So folks would pay into the public option, and then those folks who are not on Medicaid today, and he's estimating around 4.9 million people, well, they would be given this public option, this Medicare for All type plan for free. And there's no discussion of how much that's going to cost, where the funding is going to come from. And so we really do have two very different opinions on how the country should move forward, healthcare reform versus health insurance reform. And I agree with you. I think it's going to be a hot topic tomorrow night, and I just can't wait to hear more about it.
Yeah, I agree with you, especially now that the president has unveiled the Republican rebuttal, because I remember in the past, even when they were voting to strike down the Affordable Care Act in the Senate, I remember a big issue wasn't necessarily the doing away with it, but the replace aspect. That was kind of the hard thing that a lot of Republicans had. President Trump has then been teasing this health care policy for the better part of a year, only to unveil it just recently. So something tells me it is going to be a big issue come tomorrow. But Jan Dubauskas, I really appreciate you coming on the program tonight, breaking down this very complex issue in a very clear manner. Thank you.
Thank you so much, Alex. Appreciate it.